Health plans are some of the most powerful and most misunderstood institutions in American healthcare. Yet for many founders, providers, investors, and even healthcare executives, health plans remain a black box. Inside the Plan is a conversation series featuring senior leaders from America's health plans, not to defend the industry, to understand it. In this episode, Dr. Sachin Jain, CEO of Scan Health Plan, shares what founders consistently get wrong when trying to partner with health plans.
Essentially where health plans have kind of positioned themselves is we are financing care. I think one of the number one points of friction for patients is actually what care actually costs. And I think health plans at their best are actually negotiating lower costs for patients with provider organizations and creating a higher degree of transparency around what it's actually going to cost to access services. The truth is that health plans do a lot for people, but we have untold number of opportunities to be better. And I think the way many people experience health plans these days is that we're the obstacle, not the enabler, to patients actually getting their care. And I think we've taken well-intentioned policies that were intended to manage costs and manage appropriateness of care, like utilization management, and we've in many cases taken them a step too far. And we have to look at ourselves in the mirror and ask ourselves how we can be better. I think it's become very common for us to kind of talk about the broken healthcare system as if like fixing it will require deep interdependence on other parts of the healthcare ecosystem. And my argument is, yeah, there is a subset of problems that will require highly interdependent, interconnected solutions. But there's also a set of solutions that we can do today to make things better.
If you had advice for someone out there trying to partner with you, with any health plan really, what is something that people get wrong walking into these business meetings?
So first of all, I think many people bring problems that are, many people bring solutions that are looking for problems. They've built something and they're like, I've got a great asthma solution. Like you should really care about asthma because a lot of your members have asthma. And while that may be true, it may not be my first, second, or third priority. And so I think it's really making sure that the thing that you're working on is actually a problem that I need a solution for. And I think far too often, I think we meet entrepreneurs who have solutions for problems that aren't necessarily top priority problems. That's the first thing I would say. The second thing I would say is to really understand the language of like health plans. When you come in and you don't really know your way around health plans, it's super obvious. And when you have an imagined view of our levers versus a real view of our levers, it becomes super obvious. And so I would encourage, as in the same way that you would never travel to a country where you didn't actually know the language without some kind of solution for understanding the language or understanding the culture, one should not travel to a health plan without necessarily understanding the language or the culture. So I think that there's a huge opportunity to get smarter on the vocabulary, the syntax, and the problem set of health plans. And then, number three is really around like this idea of free pilots. And I've been a very vocal opponent of like what I would call pilot mania. And I say that both for the benefit of the health plan as well as for the benefit of the entrepreneur. Pilots are oftentimes engaged in way too casually, especially free pilots. There's no such thing as a free pilot in the same way that there's no such thing as a free lunch. It will cost money, it will cost time, employee hours, IT integration efforts. So I think that, and honestly, a pilot is oftentimes a way of saying, no, but maybe under some specific conditions. And I think if something is important enough to try, it's probably important enough to do as more than just a pilot. Now, all the quality improvement gurus out there will say, oh, well, like pilots, how you just get started. I'm not saying that you get started at a full scale, right away, but if an organization has kind of put itself in a headspace that you're just doing a pilot, you're cooked before you even get started.
How do you find the right leader within a health plan to actually pitch to?
I think you got to get comfortable knocking on a lot of doors. I think every organization has a slightly different, there's like the big shot strategy, go right to the CEO and the CEO will kind of delegate you somewhere. There's the functional strategy, which is like, hey, if I've got a cost of care solution, then I'll go to the chief medical officer's office, which of course may not work because a lot of times clinical operations don't report up to the chief medical officer. And then there's the I know a guy strategy, which is, or I know a gal strategy, which is like you just go where you know somebody. And strangely enough, the I know a guy or I know a gal strategy probably works better than the other two strategies, because a lot, and for good reason. Everybody's putting a lot of trust in each other to get things started, and I think most people want to know that everyone's going to behave fairly and appropriately when things don't go well, which inevitably happens. And so I used to be very skeptical about the I know a guy or I know a gal strategy because it feels a little bit too inside baseball, too nepotistic. But you just have to see a few things go south to understand that actually having a relationship with someone before you get started working isn't always a bad thing.
Yeah. And I would also, add that it's the long game in healthcare, right? We are with the same people for years and years and years. You and I know each other through a mutual contact that I've worked with since like 2017. And so like it's one of those things that's a long game in who you build your network for. So I guess just kind of an add-on question to that is there's of course the direct sales pipeline where you pitch someone, but oftentimes the I know someone pipeline has been done through years of ecosystem building. Aside from if there are folks out there, looking to make their health plan networks more robust, of course you have the direct sales pitch route. What are some other ways that you can build that network?
Fastest way to do it is to bring on somebody who has that social capital, right? Bring them on as an advisor, bring them on as an employee. And there's many people in our industry who are quote unquote nodes of relationships. Their leadership tree, their mentees have gone on to run multiple other health plans or work all across the ecosystem. And I think, if you can have a few people like that inside your business, or aligned with your business, either through equity or through consulting arrangement, I think it helps dramatically, because oftentimes it's just that conferred trust, knowing that, Sachin Jain is not going to, send me someone who's not great, and put their name next to somebody who's not great. That I think ends up being, kind of the good housekeeping seal of approval, so to speak, that an organization is worth working with.
Yeah, that makes complete sense. Last question, are there any complete, just you're talking to somebody and right away you're just turned off by the conversation because they've shown to you that they're just really not the right partners for you in whatever capacity?
Yeah, I've seen a huge epidemic recently, even among people I know, who kind of come to me and start immediately talking about their startup and how great it's doing. We've raised a Series A and we've got 3,000 customers and 400 markets and 200 plans and whatever. And I'm like, how are you? How are you doing? I don't want to work with those people, even if I know them, to be very honest with you, because, and I see it happening more and more, is like, if somebody is just all about their business, then they're not going to necessarily be listening. They're not actually, listening to subtle cues, which which actually is really important to being a good service provider, to being a good partner. You have to have a deep understanding, and if you're talking more than you're listening, you're dead on arrival. I think most of the time.
Yeah, couldn't agree with you more. And it goes back to that. This is the long game. Like you got to really. You can't just be superficial with it. You have to want to build those relationships with people, and those are the people who really are the most successful in our industry.
100%.